We all know drugs are here to help, and they have positive and negative effects. But, did you know there are several types of medication that can make you gain fat weight? Stay tuned to learn about this meds, how they affect you, what to do about it, and more. What are the weight gain mechanisms? When it comes to drug-induced weight gain, the mechanisms can vary widely depending on the drug. Some drugs increase appetite by affecting neurotransmitters in the brain, like serotonin and dopamine, which are involved in regulating mood and hunger. This change can lead to an increase in food consumption without the person even realizing it. Others might slow down metabolism or alter how the body stores fat and uses glucose, making it easier to gain weight and harder to lose it. Certain drugs can also cause fluid retention, which can contribute to weight gain and make you feel bloated. Additionally, some drugs might induce fatigue, making you less inclined to exercise, which can compound the effects of weight gain. The psychological effects, such as improved mood and reduced anxiety, might also reduce the motivation to maintain strict dietary controls or exercise routines, indirectly contributing to weight gain. How many people gain weight from drugs? Weight gain is a common side effect for many drugs, and it affects millions of people worldwide. According to some estimates, up to 25% of people taking certain prescription medications experience significant weight gain. This is especially common with long-term treatments for chronic conditions like depression, diabetes, and hypertension. In the United States, it is estimated that more than 60% of adults take at least one prescription medication, with many of these being drugs that can cause weight gain. For people who are already overweight or obese, the additional weight gain can exacerbate existing health issues, leading to a cycle that can be challenging to break. Recognizing the drugs that contribute to weight gain and understanding their mechanisms can help patients and healthcare providers work together to manage these side effects effectively. What drugs make you gain weight? Here we have a detailed list of the drugs that have the side effects of making you gain fat weight. Pay close attention, and if you are using them and trying to release weight, consult with your trusted doctor before making any rushed decisions. Antidepressants. These are often associated with weight gain, particularly the selective serotonin reuptake inhibitors, also known as SSRIs, and atypical antidepressants, citalopram, fluoxetine, and sertraline. These SSRIs can increase appetite and alter metabolism. Fluvoxamine, known to affect serotonin, leading to increased cravings for carbohydrates. Mirtazapine and paroxetine. These can cause significant weight gain due to their impact on serotonin and histamine receptors, increasing appetite and fat storage. Mood stabilizers. Mood stabilizers are essential for managing bipolar disorder, but can lead to weight gain. Clozapine and olanzapine often cause increased appetite and insulin resistance. Lithium, known to slow down metabolism and cause fluid retention. Quetiapine and risperidone. These drugs can increase appetite and alter how the body processes glucose. Diabetes medications. While diabetes medications are vital for controlling blood sugar, some can lead to weight gain. Insulin, glimepiride, glipizide, and gliburide promote fat storage and can cause hypoglycemia, which increases hunger. Pioglitazone and rosiglitazone increase fat storage and fluid retention. Nataglinide and ripaglinide stimulate insulin secretion, promoting fat storage. Corticosteroids. Corticosteroids like prednisone and prednisolone are known for their anti-inflammatory effects, but also for causing weight gain. Methylprednisolone and prednisone increase appetite, alter fat distribution, and cause fluid retention. Seizure and migraine medications. These medications can affect metabolism and appetite. Amitriptyline and nortriptyline. Tricyclic antidepressants used for migraines that increase appetite. Valproic acid increases appetite and alters metabolism, leading to weight gain. Beta blockers. Used for hypertension and heart conditions, beta blockers can lead to weight gain by decreasing metabolism. Acebutolol, atenolol, and metoprolol slow down metabolism and decrease energy expenditure. Propranolol reduces the body's ability to burn fat and may cause fatigue. Allergy relievers. Antihistamines can lead to weight gain by affecting hunger signals. Cetirizine, diphenhydramine, fexofenadine, and loratadine can increase appetite and cause drowsiness, reducing physical activity. How to mitigate the weight gain effect. While these drugs can lead to weight gain, there are strategies to mitigate these effects. First, it's important to communicate with your doctor about any concerns you might have regarding weight gain and explore alternative medications that may not have the same side effects. Dietary adjustments can also help manage weight. Focusing on a balanced diet rich in whole foods, lean proteins, vegetables, and healthy fats can help control appetite and promote a healthy metabolism. Mindful eating practices can also prevent overeating, even if medications increase your appetite. Regular physical activity is crucial in counteracting drug-induced weight gain. Incorporating both cardiovascular exercises and strength training can help burn calories, increase muscle mass, and boost metabolism. Even small changes, such as taking short walks after meals or engaging in moderate exercise regularly, can make a significant difference. Behavioral strategies, such as tracking food intake and setting goals, can enhance motivation and accountability. In some cases, consulting with a registered dietitian or nutritionist can provide personalized guidance and support. Additionally, monitoring other side effects and working with healthcare providers to adjust dosages or timing of medications can further help manage weight gain. Why combine healthy keto, walking, fasting, and strength training? Combining a healthy ketogenic diet, walking, intermittent fasting, and strength training can be an effective strategy to manage weight while on medications that cause weight gain. Healthy high-protein keto diet. A ketogenic diet focuses on high-fat, high-protein, and low-carbohydrate intake, promoting fat burning and reducing appetite. It can help stabilize blood sugar levels, reducing hunger and cravings often exacerbated by medication. Walking. Incorporating regular walks into your routine is a low-impact way to burn calories and improve cardiovascular health. Walking after meals can help regulate blood sugar levels and support weight management. Intermittent fasting. This approach involves cycling between periods of eating and fasting, which can promote fat loss and improve metabolic health. It helps control calorie intake and enhances insulin sensitivity, counteracting some effects of medications. Strength training. Building muscle mass through strength training increases your resting metabolic rate, allowing you to burn more calories even at rest. It also helps counteract muscle loss that some medications may cause, maintaining a healthy metabolism. Combining these approaches can create a synergistic effect, optimizing weight management and overall health even when on medications known to cause weight gain. Remember to always consult with your doctor before trying to leave your medications and making significant changes to your diet or exercise routine, especially when taking prescription medications. In conclusion, and to summarize today's video, in our journey to understand the impact of certain drugs on weight gain, we've uncovered a complex interplay of biological and lifestyle factors. Drugs can trigger weight gain through mechanisms such as increased appetite, slowed metabolism, altered fat storage, and fluid retention. Antidepressants, mood stabilizers, diabetes medications, corticosteroids, seizure and migraine medications, beta blockers, and allergy relievers are some of the common culprits. These drugs can alter neurotransmitter levels, affect insulin sensitivity, and lead to increased hunger and fat accumulation, making weight management a challenge for many people. Statistics show that a significant portion of the population experiences medication-induced weight gain, with up to 25% of individuals on certain prescription drugs reporting this side effect. This issue is particularly prevalent among those taking long-term treatments for chronic conditions. With over 60% of adults in the United States on at least one prescription drug, the implications for public health are significant. However, weight gain is not an inevitable consequence of drug use. By working closely with your healthcare providers, you can explore alternatives and strategies to mitigate these effects. Dietary modifications, such as embracing a balanced diet rich in whole foods and lean proteins, can help control appetite and improve metabolism. Regular physical activity, including both cardio and strength training, is essential for burning calories, building muscle mass, and boosting overall metabolic health. Incorporating a holistic approach that combines a ketogenic diet, walking, intermittent fasting, and strength training can be particularly effective. The ketogenic diet promotes fat burning by emphasizing high-fat, high-protein, and low-carb foods, which helps stabilize blood sugar levels and reduce cravings. Walking is an easy yet powerful way to increase calorie expenditure and support cardiovascular health. Intermittent fasting can help regulate hormone balance and enhance metabolic efficiency. Strength training builds muscle, which is metabolically active tissue that aids in burning more calories even at rest. Ultimately, the goal is to maintain a healthy weight while managing any underlying medical conditions. By understanding the mechanisms behind drug-induced weight gain and adopting proactive lifestyle changes, individuals can achieve better health outcomes and improve their quality of life. Remember, any changes to medication or lifestyle should be done under the guidance of healthcare professionals to ensure safety and effectiveness. Empowered with this knowledge, you can navigate the challenges of medication-induced weight gain and achieve your health and wellness goals. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.